A hearty good afternoon, good evening, and welcome to our session on back to school and child health. We are glad to have Dr. Ravi Kyadegeri among us today to help us explore the topic. As schools start up, parents often wonder what precautions should they keep or take at school. So, Dr. Ravi will help us understand that and more about child health in the session today. So, Doctor, you have the stage.
Yeah, thank you for the nice introduction. It's my pleasure to talk to parents. So, um, as school started, many of us parents were with full of joy and happiness when we were sending our kids to school. So that too, in the background of pandemic, last 2 years, schools have been offline, schools have been online, and the kids have uh, studied from the home only. So many kids haven't seen this. They did not see the school, even though they enrolled in the school. So it was a very joyous moment for the parents like us, and we send them very happily, and we took their photographs in the school uniform, and you know it was a very joyous moment as being a parent for all of us. However, this joy did not last long, and most of the parents were anxiously seeing. So this brings back to the focus, uh, back to the child health. So many parents have personally asked me, Doctor, when my child was attending a school online, I did not visit any doctors, and I have not given any medicines to my child. And within a span of 4 to 6 weeks of starting school, so my child is often getting sick, and every week child will be having one or other problem. And apart from that, many parents are also complaining that my child is finding it difficult to cope up with the school academics, and they are finding it very difficult to cope up with the other kids. So there is a frequent complaint from the school that the kid is fighting with the other kid or not listening. So many of these complaints are often presenting to all healthcare providers. One needs to ask is, what is the objective of sending a child to school? So what are the objectives? So many people will come with many answers. So like, okay, most commonly for Indian parents, the most common answer is, I want my child to uh, do very well in subjects, get a high marks, A grade, A plus grade, um, and most of some of them will tell, like, okay, both of us, both mother and father are working, so I want uh, send a child to school. So there are many answers or many objectives according to different views for different parents. However, the main objective of in a happy, healthy, safe environment. So the learning is there, but the environment in which the child studies should be very safe, healthy, and happy. So these are the main objectives of uh, sending a child to school. This objective can be extended to apart from learning aspect, it is healthy aspect, positive environment. So in the positive environment here means, so coping up with the other children, coping up with the school environment, and coping up with the other supportive staff, this how to behave with the other staff, supportive staff of the school, and and how to behave with the even with a school teacher. So this is a positive environment. So apart from that, the next is healthy. So the child should be in a hale and healthy manner, and our children to school. So if these are the objectives, who are the responsible for providing a healthy environment for the child? Which are the uh, components which will provide the healthy environment for the child to learn? Is the child alone? Is the child alone responsible for his health, his mental health, his social well-being, or is the only school is responsible for providing all the necessary safety environment and healthy environment, or only the parents, or it is only the healthcare providers? No, the objective, to fulfill the objective of the health school program, it is the responsibility of school and its supporting staff, home, that means family, parents, and the child, and the last comes in the list is the healthcare providers. Healthcare providers are the last in the list of healthy. The school include, the most important fulcrum of the school is the school teacher. Apart from the school teacher, we have a supportive staff and administrative staff. Uh, so what are the role, what role does a school play in providing a safe, healthy environment for the kid? So the most important thing is, it is a responsibility of the school to uh, formulate education policy where education is one of the important aspect of the schooling program. Apart from that, it is the responsibility of the school to ensure the adequate physical activity for the child. So there are so many studies. So whenever the child is engaged with the physical activity, his ability to learn will enhance considerably, because many of the kids may be having some attention deficit issues, or some of child may be hyperactive. So whenever the child his ability to learn will be much better than just making a child to learn without any physical activity. So goal of the school. So they should encourage play and learn. Okay, so they should encourage a play and learn. So next important thing is eat and dance. So that means the sorry, sorry for the interruption. So the next objective is encourage the children and provide a sufficient time for the children to have a snacks. Sufficient time should be provided, and the teacher should play a role model and encourage the child to eat. So the nutrition plays a very crucial part, and the teachers should be trained to trained to identify uh, the children with lag in learning, okay, and any developmental delay issues, uh, or any social issues. So the children should teachers should be trained, so that the message should be reached to the parents, and parents should be involved in this matter, and the sufficient extra time for the children to understand should be provided, so that the child will feel safe to learn, and he'll feel more confident to learn, okay. So apart from this, the teacher should know about the child's chronic problems, like some of the kids may be suffering from asthma. So the teacher should be well informed before, should alert the medical team to attend to the child problems. So this is a this is regarding the teacher. So apart from that, teachers play a very crucial role in providing a positive environment for the child. So especially this IAs and other help is especially help is of importance for the children less than 6 years. So if so like because some of the kids may be still learning about the toilet training, and so in that situation, so the support of the IAs and housekeeping plays a very crucial role. Otherwise, child will become more and more introvert, and I mean, most of the child will start crying the moment they hear about the word school. So apart from that, the bus drivers and other support staffs should be sufficiently sensitized and trained about uh, the need of the child, and supporting a very important supporting thing that all the staff members should provide. Apart from this, so what is the role of parents also plays a very important role in providing a healthy environment to the child. The most important thing is they should encourage a healthy diet for the child. So children should be encouraged to eat, even though they are picky eaters, they should keep on experimenting with all the healthy foods, and they should avoid all the like snacks and other things should be preferably avoided, and encourage the child to eat more and more healthy food. And second most important thing is the children, because many parents come and tell me that, sir, my child has lost 2 kgs in 2 months, because because when she was at home in online schooling, so she was very she has a very good weight, and now child is not gaining weight. So extra weight gain is also in the form of using running, bike, riding a bicycle, or any of the physical activity. They should encourage at least 1 hour of physical activity. This will ensure that the child will get more hungry, child will eat better, child is able to sleep early, sleep well. So the physical activity, and don't force them to do their homework all the time. At least you should designate a particular schedule for the child. You should have a very strict timing for the playing also, okay. And the third most important thing is the sleep. Sleep plays a very important role in learning, okay, and even maintaining a good health in the child. So for 6 to 12 years of age, it is recommended to have a 9 to 12 hours of sound sleep. This is a very very essential, okay. Anything lesser, if the if the child is sleeping very for a less duration of time, so that will leads to a lot of health issues, and child may not able it may not be able to concentrate in the school. So for a 6 to 12 years, the child should have at least 8 to 10 hours of sleep. And the third most important thing is avoid screen time at least 1 to 1.5 hours before sleep, and avoid any liquids, like especially the milk, 1.5 hours before sleep, because otherwise it will delay the onset of the sleep, and it will it will affect the child sleeping. And the uh, fourth important thing is providing a positive environment at the home is very crucial, because encouraging the child, okay, encouraging the child, even the child is, if he is struggling to cope up with any of the subjects, it is a responsibility of the parents to encourage, okay, engage, okay, and and help the child, okay. uh, it's not just the responsibility of the teacher to teach the subject, it is even the responsibility of the parents to sit with the child and ask the difficulties that the child is facing, and encourage him to learn, or use the other different methods to make him learn. And the other thing is providing a family time to the child. At least one meal in a day should be all the family members should have at least one meal with a child. So that will also provide a positive environment to the child. Apart from this, the responsibility of the parents lies in providing a immunization, up to date vaccination to the child. So it so they should take the child to the pediatrician and get their vaccination up to date, especially in this season. The flu vaccination is a very important vaccination, because we are seeing a lot of flu cases, so that will prevent the disease in the greater extent to the child. And other safety tips should be taught to the child, because the home plays a very important role in developing a healthy habits. So if the parent is using a mask, so then the child will automatically start using the mask. So using a mask and helping the child to learn how to wash their hands, okay, and maintaining a safe physical distance, okay, whenever your child is sick, it is your responsibility to not to send the child to the school, okay. And providing adequate rest, adequate liquids, and healthy diet, so that will help the child to regain his health back, and he can attend to the generally the child is not well, so they're not supposed to take the child to the school. Apart from that, so currently the government of India has recommended a vaccination, approved the vaccination for the children about 12 years for the COVID vaccines. So it is a responsibility of the parents to get the vaccination for the children, because still the COVID is prevalent in India, and so it is a responsibility of the parents to take to the nearest vaccination center to get the child vaccinated. Okay, this is about the the role of parent. Apart from this, there are many other things that the parents can do to encourage their child. They can engage the children with the various activities, especially the physical activity, so that will ensure that the child is child is healthy and child eats well. So the last in the list is the the last in the list is the we are the we play a role both in preventive aspect as well as the even the treatment aspect also. The preventive measures that healthcare providers preventive measures that healthcare providers takes are mainly the immunizations. So vaccination plays a crucial role in preventing at least 16 to 18 vaccine preventable diseases. So it so it is a parents have to periodically check their vaccination card and take the child to the to the pediatrician to ensure that the child is adequately vaccinated. So the most important the scenario that I come across in my clinical practice is the most of the kids will not receive their fifth year vaccination. That is between 4 to 6 years. They are supposed to receive a four vaccination. Most of the parents will forget that. And then next thing is they'll be they will not be remembering about their 9th and 10th year vaccination of their kids. So just keep the reminders or keep periodically checking the vaccination, flu vaccination once in a year. So preferably in the month of June, they're supposed to take a vaccination so that the child will be protected from the flu. If they are not already taken the vaccination, they're supposed to in ensuring that the all the diseases, most of the diseases, all the diseases are taken care by us. So currently because of this restart of the school, last 2 years they have not been exposed to the viral a lot of viral infections. So currently they are having a lot of viral infections. So so all the healthcare providers are playing a very active role currently in ensuring that the child is again ready to go to school. Okay, so this is about the objective of the uh, objective of the pediatricians. So sorry, the school, parents, and the healthcare providers. So, this is the end of the topic. We are ready to take the questions. Any specific question also we are ready to take. If parents can ask the questions. Yeah, so we have a question now. My kid is having sleep problem. How to overcome it? So, uh, this is also I have addressed earlier only. So, the most important thing is increasing the physical activity will make the child to sleep better, and at least 1.5 to 2 hours prior to the sleep, prior to going to the bed. The most important thing is setting a routine. Okay, so at 9 by 9 o'clock the child should be at the bed. So, and by 7:30, 8 o'clock, we are supposed to switch off all the screens. Okay, so that will ensure that the child will sleep adequately. Apart from that, if there are any like physical issues, like if the child is having a nose block, or child is having a cough and other elements, so we should address that those issues. So then the child can sleep better. Diet and avoiding screen time will ensure that the child will have a healthy sleep habit. And this cycle should be, regular. Like whenever the holidays comes, we parents will make the child sleep late, so then it will affect the uh, child, to to go back to the routine. So that's the reason, even during holidays also, it is very essential for the parents to make the child to sleep. Sleep and wake cycle should be maintained well. So otherwise, they will find it very difficult to cope up. What should be the ideal time for a 6 years and a 3 years old? So for 6 to 12 years old, the ideal sleep is around 9 to 12 years, 12 hours. For 3 years old, it will be little 1 or 2 hours extra. Earlier environment. So now they tend to have a very high fever, and they tend to have more frequent infection. So this will last for another this will last for another few hours only, another few days only. So once the child accustomed to those viral infections, so these issues will come down. And one more thing that I want to mention is the monsoon related diseases. The most common monsoon related disease currently that we are facing currently now is the dengue illnesses. Okay, a lot of dengue cases are on the rise, in Bangalore city particularly. So it is very essential for the parents to ensure that the uh, that they should make sure that their kids wear the full sleeves shirts and pants. Okay, so that's very essential. And even in school also, whenever we visit the school, you should inform the school authorities to maintain a very very clean water storage. And the room should be adequately ventilated, and sufficient light should be there in the school. So this you should ensure that this is very essential. Even at home also, this is very essential. Even at home also, you should ensure that the water is available. Okay. Thank you, dear parents, for the patient listening. Uh, um, we are ending this session. If there are any queries, you can always post to us in any of our social media platforms.